Hi guys, so today in this video I'm going to be talking about the most compassionate people you will see in the medical field. The people who are strong enough to tolerate anything and soft enough to understand everyone. The nurses. Specifically talking about their specialties, but more in the ball field of their education, their pay, and their duties. We're going to start off with entry-level positions. A lot of people say these aren't nurses, however they're very important in the nursing field. We're going to start off with the certified nursing assistants, your patient care techs, and your orderlies. They make approximately $26,000 annually with a 17% expected job growth in the next 10 years. They have something called a certificate degree, which is usually 6 months to a year, and they help bathe patients, help them with the restroom, turn and reposition patients, transport patients, check their vitals, and serve meals. These are usually found in long care facilities and some are in hospitals. The other entry-level position we're going to be talking about is the licensed practical nurse or the licensed vocational nurse. They make 44 grand annually with a 12% expected job growth in the next 10 years. They have a postgraduate non-degree, which is usually 1 year. They check vitals, provide basic care such as bandages and catheters. They help bathe and dress. They keep records and report and discuss care. They are usually in hospitals, some are in home health, and they are in long-term care facilities. Now we're going to be talking about your graduate nurses or your registered nurses. They make $68,000 annually, and there's a 15% expected job growth in the next 10 years. They can have an array of education. They can have a diploma, an associate's degree, or a bachelor's degree. For the bachelor's degree, it's 4 years, as we all know, and usually you'll get a bachelor's degree if you plan on moving up ranks in nursing, such as becoming a nurse practitioner or a DNP. Also, most hospitals now are requiring you to have a bachelor's degree in science and nursing, and a bachelor's degree. You can also get an associate's degree, which is 2 years, and rarely you can get a nursing diploma, which is usually through a hospital program. Registered nurses address conditions, take history, observe and record records. They administer medications and treatments. They set care plans. They operate equipment, and they educate and explain treatments. These are usually in your hospitals and some are in long-term care facilities. Let's talk about your advanced degree nurses or your nurse practitioners. There's an array of fields you can go in as a nurse practitioner. There's an array of different salaries you can make. This is just a median salary. You have your certified nurse anesthetist. You have your family nurse practitioners. You have your emergency nurse practitioners. You have your midwives. As I said before, there's an array of different fields you can go into. They make approximately $107,000 annually, and they make a 15% expected job growth. You can have your master's degree or your doctorate degree. I've recently heard stories to where doctors are getting upset that nurse practitioners with a doctorate degree are calling themselves doctors because they are not an actual doctor of osteopathic medicine or doctor of medicine. Anyone who has a doctorate degree has the right to call themselves a doctor. However, doctors, MDs and DOs, do not want a misconception of their care provider. Anyway, nurse practitioners take records and history, they examine and observe patients, they create care plans, they perform and order diagnostic tests, they operate equipment, they analyze tests, they diagnose, they give medications and treatments, they research, they evaluate the patient, they consult with doctors, and they can prescribe medications. They're usually found in doctor's offices, hospitals, and in some states they can have their own private practice. So in summary of all this information I just threw at you, as you can see, the more education a nurse has, their responsibilities along with salary increase. All degrees and requirements may change from state to state. All my information is from bls.gov. Your caregiver, no matter what degree, will only do the job that they're licensed to do. So don't worry about who is caring for you based on their degree. They are all very important in the medical field. So appreciate a nurse. If you like this video or any of my other videos, don't forget to subscribe and follow me on Instagram. The link is below. Thanks for watching.